6 tips to protect yourself and others from COVID-19 coronavirus. As we all know, there's currently no vaccine to stop coronavirus disease 2019 COVID-19. And unfortunately, the recent studies have suggested that COVID-19 is also spread by those that aren't showing symptoms. So, to protect yourself and others, everybody should follow the next 1. Wash your hands often. 2. Keep social distancing. 3. Use a face mask. 4. Cover coughs and sneezes. 5. Clean and disinfect. 6. Monitor your health. Wash your hands often with soap and water for a minimum of 20 seconds, especially after you've been in a very public place. If soap and water aren't readily available, use a hand sanitizer that contains a minimum of 60% alcohol. Cover all surfaces of your hands and rub them together until they feel dry. Avoid touching your eyes, nose, and mouth with unwashed hands. Keep social distancing 6 feet at least. The face mask isn't a substitute for social distancing from the other. Put distance between yourself and people outside of your home. Remember that some people without symptoms is also ready to spread virus. Do not roll up groups. Stay out of crowded places and avoid mass gatherings. Keeping distance from others is very important for those that are at higher risk of getting very sick. Cover your mouth and nose with a face mask when around others. You could spread COVID-19 to others whether or not you are doing not feel sick. Everyone should wear face mask cover once they need to venture out publicly. Face masks shouldn't be placed on young children under age 2, anyone who has trouble breathing, or is unconscious, incapacitated, or otherwise unable to get rid of the mask without assistance. The face cover is supposed to guard people just in case you're infected and protect you from the infection. Always cover your mouth and nose with a tissue once you cough or sneeze, or use the within of your elbow, then throw used tissues within the trash. Immediately wash your hands with soap and water for a minimum of 20 seconds. If soap and water aren't readily available, clean your hands with a hand sanitizer that contains a minimum of 60% alcohol. Clean and disinfect frequently touched surfaces during your daily routine cleaning, as example, tables, doorknobs, light switches, countertops, handles, cell phones, keyboards, toilets, faucets, and sinks. Use detergent or soap and water for cleaning before disinfection. Use a household disinfectant. Monitor your health, be alert for symptoms. Sit up for fever, cough, shortness of breath. If you're running essential errands, going into the office or workplace, add in settings where it's going to be difficult to stay a physical distance of 6 feet. Take your temperature if symptoms develop. Don't take your temperature within half hour of exercising or after taking medications that might lower your temperature, like acetaminophen. And always remember that prevention is better than cure.